I'm sure most of our audience, certainly outside the metropolitan area, have never heard of the city of New Rochelle. Well, the city has about 80,000 people. It's only 20 miles from Midtown Manhattan, or a quick 25 to 30-minute train ride. Now it's become an epicenter of the coronavirus after an attorney with deep ties to that city's Orthodox Jewish community contracted it and unknowingly spread it. Right now, New York State has more than 40 confirmed cases. The vast majority of them stem from that New Rochelle man. Plus, health officials, they have no idea how he got it, which is even more concerning. It all started when that attorney who takes the train to work tested positive. After that, his wife, their 2 kids, and the friend who drove him to the hospital were also diagnosed with the virus. It metastasized from there, turning into dozens of cases, leading to more than 1,000 people under quarantine. It has also led to a slew of school closings as well as other disruptions. Patient Zero's 14-year-old daughter attends a private school in the Bronx. That school remains closed. Other schools in Westchester also closed as a precaution. And his 20-year-old son is a student at Yeshiva University in Manhattan. That school has also canceled classes for now. This map, it shows how the virus was able to spread so quickly from just one original patient. That man attended a temple in New Rochelle 2 weeks ago, and now everyone who was there is under self-quarantine, and the synagogue is halting services through at least Sunday. That includes hundreds of people, as there was a funeral and a bat mitzvah, so many people even traveled to get there. Several people from as far away as Baltimore and New Jersey are also under self-quarantine as they attended, and 2 caterers from that bar mitzvah, they have also just tested positive, and they live across the Hudson River in Rockland County. Also, colleagues of the Westchester attorney and his Midtown law firm are also being tested for the virus. Take a listen to how Governor Cuomo had to comment on the situation.
This is one of the more complicated situations that we've come across because of the number of interconnections that this family has presented.
So let's be clear. Yes, this is one city in Westchester, New York, but whether you're watching me in New England, the Mid-Atlantic region, you're watching me in Texas or California or anywhere else, this could happen in your community. So what we decided to do was talk to the person who's on the ground dealing with all these questions. I want to bring in the person who runs New Rochelle, Mayor Noam Bramson. What a week it's been, Mr. Mayor. The last 96 hours, can you give a sense as to just how upended the city of New Rochelle has been?
Well, there's been a surreal quality to it. Certainly has cleared everything else off my schedule and has had a much more disruptive impact on hundreds of our residents, especially those who are going through a quarantine right now, which at a minimum poses a day-to-day hardship, but we recognize there are also folks who are worried about their own health, the health of their families, the health of their neighbors. And yet at the same time, I have been so impressed by and grateful for the manner in which this city has risen to the occasion. Residents are taking direction from public health officials. They are engaging in common sense practices. There has not been any panic or hysteria. People are approaching this in a way that is calm and serious and measured and proportionate to the challenge.
You described it as a moving target. Is that the hardest part of this, unlike when you're dealing with natural disaster, or that there's a beginning, a middle, and you can define wherever the end will be, at least you know? With this, you don't know what the next day will bring.
Well, yes, that is a part of the challenge, although logic tells us that the number of reported cases will continue to increase. Now, it's important to stress that that does not necessarily mean that the illness itself is spreading, rather that detection of the illness is spreading. We become more aware of those who have been infected. So it is impossible to know the scope and scale that this will eventually stabilize at.
So, to me, what I would imagine, and by no means do you or any mayor of any city act unilaterally. There's officials from certainly the county, from the state level, even the federal guidance coming to you, the health departments. But from one day to the next, some schools close. Some places won't have basketball tournaments, for example, while the neighboring area will. There doesn't seem to be a uniformity to this. Some houses of worship say, don't shake hands. That hasn't been enforced in other places. How do you navigate that when your constituents say, wait a minute, they're doing this, we're doing that, who's right, who's wrong? How do you temper the balance between being cautious without being hypochondriac or not being vigilant without being reckless?
Well, you just put your finger on, I think, exactly what is the central public challenge. We want to make sure that we approach this with a level of focus and concern and seriousness that is commensurate with a very serious public health challenge. And at the same time, we want to make sure that we don't stray into panic, which would create its own problems. We can't simply withdraw from the life and commerce of our communities entirely. Now, when there is clear direction from a public health authority, from a public health expert, then the choices that are made by localities or school districts or families become relatively simple. The right thing to do is simply follow that guidance. But there are other cases in which it's shades of gray, and it's a matter of reasonable people using common sense and deciding what is their own risk tolerance. You know, for example, the county executive and I went out to lunch together at a kosher Asian restaurant in the Waikiki area. We did so to demonstrate that we ourselves are completely confident that we can do this without any threat to our health whatsoever.
I can only imagine, if I was sitting at that desk, the amount of unknowns going into this and really not having a walkthrough like this before. What do you do, for example? You have a lot of apartment buildings. What if somebody is self-quarantining in an apartment building, and even if the science says, you know, it can't be transmitted just by being in the same building, there is a human element to this, and there's going to be fears. What are some of the realizations you came across that you never would have thought of until you've gone through what you have the last 72 plus hours?
It's interesting, you raised that as a hypothetical example. I did hear from a co-op leader at one of the large multifamily complexes that's in the area that's most heavily affected, with questions and concerns about exactly what sort of guidance should be offered to residents of that complex. So I connected her with an official at the County Department of Health. That county official was in turn in touch with counterparts at New York City who obviously have the most experience with multifamily units. And so the hope is that through that process of sharing information, people locally can be better armed with what to do.
Do you think you almost have to prepare your residents that this is going to get worse before it gets better? As you said, when more kits become available, there'll be more testing and there'll be more detection. Whether or not it's more cases, maybe it's a byproduct of just having more information, but nonetheless, there'll be more. You're going to get questions. Should people go on Metro North to get on the train? Should they go to the basketball game? Should they go to the mall? Should they? How are you going to answer that when you don't know when and how this ends and how big this gets?
Well, by being honest about what we know and don't know in all of our communication, and this is true for the county and state as well. We've indicated that there's every likelihood that there will be additional cases reported in the days ahead. We haven't put some artificial deadline on when this is going to end. What we have committed to is sharing information as we have it, recognizing that new directives may follow as warranted, encouraging everyone to stay abreast of the news and continue, again, engaging in common sense practices that can protect themselves under all circumstances, and taking it one day at a time. So I don't think there's any other way to approach this. But again, the good news is I think most people understand that, recognize that, are approaching this in a way that is logical and mature. And we'll get through this.
When you get through this and you'll look back, even though there seems to have been terrific cooperation from the top down in New York for this, this hopefully will not be a new normal, but we should plan that we'll have to deal with something like this again. What needs to happen for people who sit behind desks like yours that are mayors in this country that you don't have or we didn't have in place that we need to have, whether it be on the medical side or whether it be protocols that don't exist right now? I mean, you deal with every facet of this, from the folks on the medical side to the leadership and everything in between. What isn't there that would have made this much more helpful as you look back in the last whirlwind of a week?
Certainly, I think there'll be an effort at every level to absorb lessons once this episode is largely behind us and figure out what we can do to better prepare in the future. But there's also that great Mike Tyson line, everyone has a plan until they get punched in the mouth. And we should recognize that every incident like this will have its own peculiar, unique characteristics, which cannot necessarily be anticipated in advance. And it's why having a relationship between different public authorities, between different levels of government, that is based on cooperation and trust is, in the end, maybe the most important asset, because it enables you to respond flexibly and effectively to whatever comes your way.
Yeah, siloing, as we've learned, never works here. But and I never meant this more so than now. I wish you the best of luck. Honestly, from everyone I spoke to, you and a lot of other folks here have handled this the right way. But it's the unknown, right? And good luck with that.
Thank you very much, Richard. Appreciate it.
Okay, up next, we will pivot to the financial consequences of coronavirus. An expert on the markets, he'll join us to discuss how bad this could get for stocks and even the entire broader economy.